Story time. A few months ago, I had to go for a laparoscopic surgery. Now, for someone like me who had no idea what a laparoscopic surgery is, I'll give a brief explanation so that we are in the same page. A laparoscopic surgery is a medical procedure whereby doctors use a laparoscope or a camera to treat and examine conditions that are in the abdominal or pelvic area. This surgery has its benefits because it's minimally invasive, it offers shorter hospital stays and quicker recovery times. So as opposed to a laparotomy, or what is commonly known as a C-section, the doctor opted for a laparoscopic surgery to treat my condition, of which I'm very glad, because as opposed to a C-section, I just have a few scars that are already fading away. As you can see on the picture displayed, okay, not exactly a picture I will love the internet to see, but it's all I have. It's just to give a brief or to give a light of what this surgery is like. Now, why did I have to go for this surgery? So earlier in the year, I was diagnosed with uterine fibroids. Just to take you through my journey, struggles I faced, the symptoms I experienced. It started back in 2023. I went to see a doctor because I had abdominal pains. And now the doctor said that I have a UTI, a urinary tract infection, of which he prescribed antibiotics. I took the antibiotics, and within a day or two of taking the antibiotics, I was okay. However, in few months down the line, I would say in 3 to 4 months, I was back at the doctor's room with the same complaints, of which again he prescribed the antibiotics, and again I took them and I was okay. Now back again in 2024, I'm back at the doctor's room with the same complaints. It's now 2024, I'm back at the doctor's room again, and now the questions are starting to arise from the doctor, like, what's your daily routine like? Because having a UTI come back over and over again is totally not normal. But in my mind, it doesn't seem like there's something wrong. For me, it looks completely normal. I'll tell you why. I'm generally a person who drinks a lot of water every day. When I say I drink a lot of water, I would say 2 liters and above. Also, the doctor also alluded to the fact that perhaps if you drink a lot of water, you wouldn't be coming back to the doctor with the same issue over and over again. So when I drink and I made it a point that I drink tons of water throughout the day just to avoid the problem. And the thing about drinking water, there's gonna be a point in time, perhaps maybe in a week or 2, I'm gonna be in a position whereby I'm gonna have to hold pee a little longer than normal. So you get it. If you hold pee for a little longer than normal, then it's more likely that you're gonna get a urinary tract infection. It's now February 2025. I'm at the doctor's again. The only difference now is that I had been at the doctor's at the week before. Now what's happening is that my body is not responding to the antibiotics. Like I've said before, that usually I would respond to the antibiotics within a day or 2 of taking them. Now my body is not responding to the antibiotics, and my doctor decides that no, definitely we need to do more tests now. Okay, so tests are run, blood, urinary tests are taken to the lab to check what could be the problem. I remember one of the tests that was performed was to check the functionality of my kidneys because of the nature of the pain that I had. The tests come back from the lab, they're positive, there's nothing wrong. And then the doctor decides now, okay, now I'm sending you to a sonar or an ultrasound, because on my own I cannot detect what could possibly be wrong. I go to a sonar, and then on the sonar, that's where it is discovered that I have uterine fibroids. I'm a bit relieved because I was beginning to think that perhaps maybe I might have a life-threatening disease. And in my mind, I'm thinking, okay, I've never heard of anyone who's died of uterine fibroids. I'm relieved. In fact, I don't even need to go to a surgery because that I know for a fact that's what doctors are going to recommend. In fact, I've seen people talk about fibroids on TikTok. So I go on TikTok, I find the videos, and on the videos people are talking about natural remedies on how their fibroids have shrinked when they've taken the natural remedies. I find the videos, I buy everything they talk about. When I say everything they talk about, I buy cayenne pepper, I buy ginger, I buy herbal teas. I start drinking them, and I'm gonna be honest, the pain totally goes away. I think that also because my mind was convinced that maybe I might have a life-threatening disease. I'm now also relieved. I'm like, nobody's died of uterine fibroids. I take my concussions, also the pills that I was given by the doctor, and life carries on. We're good. I'm good. I'm not feeling any pain. I'm totally fine. Fast forward to March, somewhere in mid-March, I wake up one fateful Saturday. I can feel a bit of pain on my waist, but I'm not stressed. I'm like, I have my diagnosis. I already know what's wrong with me. I'm just gonna take my concussion. I'm just gonna boil my things, drink, and I know I'm gonna be okay. I carry on with my day. I go to the gym. Once I'm at the gym, I feel like, okay, the pain is getting a bit worse, but still I'm not concerned. I'm like, okay. I go home, I boil my stuff. My ginger, cayenne pepper, herbal tea, mix everything. I drink, and I'm like, let me take painkillers this time around. I take my painkillers, and perhaps let me lie down. Perhaps when I wake up, I will be okay. I lie down, I take my stuff, and I lie down. The only issue now is that the pain is actually getting worse. It's not getting any better. The painkillers and my concussions are not working at all. It's getting worse by day. I'm now at a point whereby, okay, I think I need to go to the hospital. I try get up. I'm struggling to get up. I'm experiencing a very severe pain on my waist. I can hardly move. I can hardly get out of bed because of the pain in my waist. I'm even thinking I should call an ambulance. But I'm like, okay, my sister, that's a bit dramatic. An ambulance, people are gonna be looking at you. That's a bit dramatic. I try to get out of bed. I have the most excruciating pain. I am crying like a baby. I get out of bed, try by all means. Even tying my shoes at this point is an issue. Finding something to wear is an issue. I am crying. I can't do anything. I can't walk. I can't sit. Fine. I finally managed to drive myself to the hospital. When I get to the hospital, at the emergency area, fine, I'll tell them my issue. A gynecologist is called, and the first thing he says, ma'am, you look so pale. I don't know what's wrong with you, but you are definitely very sick. Also, one thing I forgot to mention, the pain is no longer just now on my abdominal, it's on my lower back. I have a radiating leg pain, and also I'm feeling nauseous and a slight headache. Then the doctor runs his tests. The gynecologist also puts me on a sauna just to confirm, just to see what exactly could be wrong. And he says that, okay, ma'am, I see the fibroids. That's not a problem. We will go through surgery. In fact, I'm going to admit you now, we're going to go through surgery. We will get rid of the fibroids. But the reason, what concerns me most, is something else, which is why you are struggling to walk or sit. It's something else. It's something bigger than fibroids, of which I will talk about this new diagnosis on my next video.